Thank you so much for agreeing to answer some questions here. And we're going to try to, like I said, go through a number of these as well as some of these questions that I had. The first one is a question, I have something I want to add to this one, but which is, which exercise is more beneficial? Exercising indoors or outdoors as well? So the question is like, they want to know what kind of exercise, and I want to add to that cardio versus strength as well. So if you want to just tackle that exercise question generally.
Yes, so cardio does trump strength exercises. They're both healthy for us. But the cardio exercises are more comprehensively healthy, particularly in regards to brain receptors and also in regards to brain uptake of nutrients to make our neurotransmitters. And so your swimming, running, bicycling, particularly the large muscles, the largest muscles in the body, their skeletal muscles, are in your lower extremities. And so lower extremity exercises that are repetitive actually beat upper extremity exercises that are repetitive in regards to overall mental health. Wow. And so outside versus inside, outside is certainly better. And actually it's easier to do cardio outside. You've got, you've got live scenery, you've got the forest bathing, you've got those oils, so nature is a great place to do that. You're getting infrared, so you're working on multiple natural remedies at the same time when you're outside versus when you're inside.
Oh, awesome. So a question that I also had here, we've heard a lot about health span and lifespan. It seems like medical science has really helped us on the lifespan, but at the same time, our lifespan, but our health span has gotten shorter and shorter. And one of the debates or one of the questions is, we have two big levers. These aren't the only levers, but one is nutrition and the other one is exercise. If you were to put them head to head, which is more important to make sure that we can both maximize health span and lifespan?
So yeah, health span, of course, is your quality of life. And as far as those natural remedies, we don't have all of the data in, but we do have some pitted against each other. One thing that we can say clearly is it's actually better for you to get 1 hour less of sleep per night if you replace that with 1 hour of exercise. And so a lot of people don't exercise because they, quotes, need more sleep. But you want to, as long as you're getting 4 hours minimum, I wouldn't say go from 4 to 3 to get your exercise. But even if you're sleeping, 7 hours a night and you're thinking that's not enough, you'll actually do better by cutting it down to 6 hours and taking that 1 hour that you would normally get your seventh and going out and exercising. And that's clear in regards to physical health, brain health, and particularly brain-derived neurotrophic factor. Brain-derived neurotrophic factor is a brain fertilizer that helps our brain stay young. It helps us to be able to learn new things, and it helps our neurotransmitters. It's kind of a natural antidepressant. And studies show that your BDNF does not go down even when you're sleep deprived if you are exercising aerobically at least an hour a day. And so that's one of the reasons why Erica and I, even with her recent sleep deprivation that I revealed to the whole group here, is their BDNF is going to be okay if she is exercising. And she was actually out there with me exercising even though she was sleep deprived that morning.
Amazing.
So exercise versus diet, it really has to do with one of the things that is very healthy, I mentioned it yesterday, is carbs. But healthy carbs are really even not healthy if we're not exercising. That's the energy producing aspect of our diet, and we want to expend that energy in order to get the greatest benefit. Studies from the Finnish show that they stay very healthy when they have a construction exercise type of business, but when they retire, they're dead before they're 70. They retire at 65, virtually all dead before 70. Why? They stayed on their unhealthy diet and quit exercising. And what was protecting them from that unhealthy diet was that exercise. And so particularly if our diets are not ideal, we're far better off exercising in order to compensate at least some for that.
Wow. Okay, that's super, super helpful. Here's a question from the audience. Is trampoline rebounder workout a good form of exercise?
Rebounding is a great form of exercise, particularly in regards to our bones. So one of the greatest ways of preventing osteoporosis is jumping. And even when you have early osteoporosis on these DEXA scans, the exercise I recommend for everybody is jumping. And if you've got advanced osteoporosis, I recommend one of those rebounders and just grab onto something so you're not going to fall. But just those little trampoline bouncing 100 times, a couple of times a day, tells your bones not to have those osteoclasts outdo the osteoblasts. But when we are not jumping and just doing routine types of exercises, our bones think that it needs to turn over. And so one of the reasons for osteoporosis is people no longer jumping after the age of 15 or somewhere.
Wow.
So
would running count as jumping?
Running is a form of jumping.
Yeah.
Yeah.
So it would count.
Yeah.
Okay, very good. Another question, what can a person do for memory loss, and is it a sign of dementia?
So memory loss does not mean dementia. Dementia means that it's permanent and irreversible. And what I recommend is, if possible, to take what we call an MCI memory test. This is what I utilize for my patients. It's much more sophisticated than the mini mental status exam, and it can catch memory loss at an early time period. The reason why we want to catch it early is if we catch it early enough, we can reverse it and we don't have to worry about the dementia aspect. Dementia most of the time is caught late. People can cover for it, they don't think it's that bad, and then it can really get out of control. And so memory loss, what can cause memory loss that's not dementia? I think we mentioned it last night. B12 deficiency can be one of those things that can do it. Also metabolic issues. Metabolic syndrome is one of those things that will cause your memory to decline, even though it's not necessarily dementia. Maybe we'll talk a little bit more about how to prevent that later. But there's a whole host of things. Not enough omega-3 can be an issue. Not enough antioxidants in the diet can be an issue. And also too high of blood pressure and too high of cholesterol. If anyone starts to lose their memory a little bit, I'm wanting their blood pressure less than 115/80. One of the things that causes memory loss, premature memory loss, is hypertension. Well documented to do that. Your brain shrinks and it atrophies much greater when you have hypertension. So we want to control that blood pressure less than 115/80. We want to get that cholesterol down to less than 100 plus your age. And we also want to make sure you have those nutrients that are important to maintain cognitive health. One of the things I like to mention to people, it is natural that we're going to lose mitochondria and we're going to lose physical function as we age. It's just one of those things, no matter what we do, it's going to start happening. But it was not designed for us, even in our fallen state, for our brains to deteriorate with age. That is abnormal. It's not this whole thing that's called age-related cognitive decline. That phrase should be eliminated because age should not cause you to cognitively decline. And if you talk to Dr. John Scharfenberg at age 100, his memory is sharper than the typical 25-year-old that's on screens all the time. And his brain is still able to learn, retain, apply knowledge at 100. And if you are very smart when you're young, you should be even far smarter as you age, and it should not go down. So we should not put up with this idea that our brains are going to deteriorate with age. It's a sign that there's something wrong that needs to be fixed.
Wow, very good to know. And I also liked how you connected that to metabolic health.
Yes.
Because I've actually heard people describe dementia with what they call now type 3 diabetes.
Yes, and that's type 3 diabetes, of course, is talking about metabolic health, causing the dementia. It also can cause depression. It can cause anxiety. And what happens, metabolic syndrome is actually insulin resistance. And insulin resistance will prevent your tryptophan from crossing the blood-brain barrier and going into serotonin. It also prevents tyrosine from going across the blood-brain barrier. Now, one of the things that a lot of people don't realize, and that you'll find this out by some of the supplements they're taking, is if you give a patient IV serotonin, it does not help their depression at all. If you give them IV dopamine, it doesn't help it at all. Why? Those molecules do not cross the blood-brain barrier. They're too large to cross the blood-brain barrier. That means we have to have our own manufacturing plant of dopamine and serotonin in our brain and norepinephrine and these other neurotransmitters. So our brain has to produce all of that from the natural substrates, but those natural substrates do not diffuse across either. If you give someone a tryptophan supplement, it doesn't mean any of that tryptophan is going into the brain. By the way, if you eat turkey because it's high in tryptophan, virtually none of that tryptophan from turkey gets into your brain. It'll get into your muscle and other places. And so how do you get tryptophan into the brain? There's several things that have to occur, but one of those is you have to have insulin sensitivity. And one of the best ways of getting insulin sensitivity is back to cardio exercises again. Yeah. And so this is why, some people come to our depression and anxiety recovery program for the nutrition part of things, and they're saying, Dr. Nedley, you're exercising me too much. No, it's the nutrition plus the exercise that's going to do that. So when they get to our program, it's not going to be like at home, but we're wanting them to get fit fast, and so we do IT. Most of our patients are exercising 2 to 3 hours a day in order to be able to optimize those brain manufacturing plants of those neurotransmitters. And that will make a big difference. By day 7, they'll start noticing some significant differences. And of course, on top of that, that means we need to have the right diet that's not too high in fat, that is the right type of carbohydrates. And we also need even the sunlight. It turns out that the sun hitting the eyes in the morning will turn on the serotonin manufacturing plant, so we can get that serotonin going in the morning. So the first thing we're doing before they even get outside and exercising, if it's wintertime, is being exposed to a medical grade light box. And that light through the eyes is going to start that serotonin production and reset their body clock.
Wow. Just following up on the metabolic health, I had a number of questions related to that. Like, what are the key contributors driving metabolic syndrome or insulin insensitivity? What are the key drivers for that?
Well, of course, genetics can have a significant role to play. Almost half of this world's population has the gene for metabolic syndrome. And depending on which place you live, sometimes 80%, 90% of individuals from the Pacific Islands have the gene for metabolic syndrome. And so it's very important for them to, even more important than other societies, to be exercising and to be on a healthy diet. Also, obesity, that high body fat content is going to lead to metabolic syndrome. And so particularly lowering your body fat content and getting that BMI down to an ideal BMI, of course, which has to do with body size and other sorts of things to know what the ideal BMI is per individual.
Very good. And again, I just want to follow this thread a little bit longer. When it comes to insulin resistance or metabolic syndrome, I've heard of a lot of diseases actually flow from that. So it's not that you just get diabetes and that's your disease, but actually diabetes is a precursor. Diabetes is an extreme form of insulin resistance, but it's also a precursor to many other diseases. So I thought it would be good to understand that a little better as well.
Yeah, there's a term out there now called diapression as well, because if you have diabetes, you're going to have that challenge is making those neurotransmitters. And of course, you also have kidney failure. Half of the people are on dialysis in our nation, and the kidney failure rates are astronomically going up, are simply due to not treating metabolic syndrome. Or the more extreme forms of metabolic syndrome. And it's actually not half. I should say half are frankly diabetics. The other half were hypertensives. And hypertension is actually a metabolic syndrome disease. In fact, most diabetics will first have high blood pressure. And that's a big key. If you have high blood pressure, diabetes is very likely coming your way, or you have metabolic syndrome within a few years. And a lot of times those are treated independently, but they're actually from the same gene, and they're also from the same type of lifestyle. And so when you look at those, we're looking at peripheral neuropathy, which is a significant disease that comes from metabolic syndrome. We're looking at stroke. We're looking at coronary disease. We're looking at circulation issues, which include claudication, gangrene, and then on top of that, we're looking at retinopathy. And so eye diseases also many times have their origin in metabolic syndrome or metabolic disease. And that's just a partial list.
Wow. Wow, wow. So you went through a number of warning signs, like high blood pressure is a warning sign, memory loss is a warning sign. What would be some other things people should be looking out for to think, okay, maybe I should go, get this thing checked and then make lifestyle changes?
Well, I would recommend everyone get a hemoglobin A1C. It's not a very expensive test, and you can actually have a finger stick now, a hemoglobin A1C. And that hemoglobin A1C is going to tell you what your average blood sugars were over the last 3 months. And don't look at the, quotes, normal values. The normal values, they have fudged for the, quotes, what 95% of the apparent normal healthy population is in America. But 50% of those apparently normal healthy are not normal and healthy. They have diseases coming their way. And so the ideal hemoglobin A1C is actually 5.3 or less. And so if you're 5.4, you actually have metabolic syndrome. And if you're above 5.7, the cat is out of the barn. You're already experiencing central nervous system complications and other types of complications. So that would be probably the simplest screening test to know whether you might have that or not.
Got it. Now, just on that particular test, the H1C, that one I've also heard that there can be, depending on your blood type, some sort of false positive or false negatives as well, meaning that you may show a higher result, but in reality, you may have an average blood sugar, let's say, of 90 millimoles or so. So I don't know, do you have any thoughts around that, the fact that, the age of your blood cells can play an impact on the results?
Yeah, so the average age of your blood cells is 120 days is how long our RBCs last. And if you're an athlete, it's lasting less than that. And so RBC turnover is higher in that. So there are some other factors there, but that's also why I put that 5.3 in there.
Right.
Because the world sees you as completely normal at 5.4 and 5.5. But if we take it down to that 5.3, it becomes a much more sensitive test.
Yes, very much so. All right, let me turn back to some of the questions from the audience. So this one is actually having to do with that WeMart Health Coach, where you mentioned about the program with this hospital. And the question was, does the $3,000 cover room and board?
It actually does. The whole thing is $9,000, but the hospital is subsidizing that. So yeah, it's a pretty good room and board fee for the Weimar area, and it would include all of that. But in order to do that, you have to, of course, apply and get screened by them as well, so that you get approved for that as well, because they want to make sure that you're not just going there for $3,000 and then going home again.
Right.
They're going to support you as long as you support them afterwards.
Right.
And so that's why that whole screening
You have to commit to go work, absolutely.
You have to commit.
Can you get B12 from nutritional yeast flakes?
Most nutritional yeast flakes do not have B12. There is a form of nutritional yeast flakes that does. I think it's number 39, so you have to look at the number of the yeast flakes. But most have other B vitamins, but not B12. There's only one specific type that does.
There's only one specific one, okay. What can somebody use for magnesium deficiency?
Well, the magnesium is present in legumes, also seeds, but of course you can also get in a supplemental form. And so we recommend supplements for a while sometimes if the magnesium is low enough. Magnesium oxide is a good supplement. If you're having issues with your bowels, constipation, magnesium citrate is a good form of magnesium. So there's different forms of magnesium that we can utilize to get it up there. And fortunately, you know, the body needs about 400 to 500 milligrams of magnesium a day. It's one of those macro minerals that we need in large amounts. And you can safely take up to 2,000 milligrams a day in order to get your desired effect.
And what is the effect of stress on your magnesium levels?
It can lower the magnesium levels, yeah. And so, yeah, if you're not coping adequately with stress, that's one of the reasons why we might see magnesium deficiency and a magnesium level. By the way, what is magnesium deficiency? Again, you don't want to look at your lab levels on that. It'll tell you you're okay. If you're 1.8, you're not okay. It should be 2 or above your magnesium level for optimal health.
Oh, interesting. Are there any supplements you would recommend that cannot be received from foods in adequate amounts, specifically B12, D3, and folate?
So D3 is best gotten from the sun. Yeah, I heard someone this week on the internet, my son forwarded him because it was someone that used to work at Weimar that has some sort of YouTube channel and was really criticizing the vegan diet because it was short in vitamin D and says you can get it from mushrooms, but you have to eat this many mushrooms. And so it's a terrible diet to be on. Well, you don't get vitamin D from animal foods much either unless you're eating animal liver or unless you're scraping all of the skin off of sheep that are out there all day long and then trying to eat that to get their vitamin D. And so vitamin D is not best from foods. It's actually best from the sun itself. And so we don't need the diet for that. Folate is from foods, so you have to get that from foods, and animal-based foods are very poor in folate. This idea that you can get all of your nutrients you need from animal foods is false. Vitamin C, you can't. Folate, you can't in any appreciable amounts. And so that's going to be more of your plant-based foods. And the third one
was
that was
B12.
mentioned,
B12.
B12, we mentioned that last night, not by plants or animals, but by bacteria. There is another one that I would mention that's also from bacteria that we don't talk about. The world hasn't necessarily caught up with it much, but it's vitamin K2. K1 we get from vegetables, again, not from animal foods, but from vegetables. K1 is very important. But K2 is made by healthy bacteria, and K2 is needed for bone density, also for soft tissue, and for hair. And so if you're losing hair not due to a genetic condition called alopecia areata, which is a male pattern baldness, the vitamin K2 can be very important in helping to restore that and also make your teeth better and your bones stay strong over time.
Right. And I've also seen K2 being combined with D3 for some, it seems
Yeah,
like,
because D3 also helps for osteoporosis. So both of those are treatments for osteoporosis. And out of those, K2 is more important even than D3.
Okay, interesting. Do the white and blue lights recommended in the depression recovery program provide the red spectrum you talked about?
So you can't get the red spectrum from indoor lights, and you also don't get it from regular medical grade light boxes. The medical grade light boxes that I talked about earlier, those are blue light boxes, 480 nanometers wavelength, and that wavelength is actually what turns on your serotonin production and also causes your body clock to be set. White light can do it as well, but you need brighter white light. You need about 10,000 lux to equal only 400 lux of blue light to do the same thing. But neither one of them will produce the infrared light. So if you want to get infrared, like we talked about last night from the sun, it's the near infrared, not the ones in saunas. The saunas are the far infrared, but the near infrared, which is 850 to 1500 nanometer wavelengths. And now they do have LED lights that produce that wavelength. The nice thing about those LED lights is there are no known complications at all. There is for ultraviolet light, obviously, there's complications, but no complications at all from infrared light. And I can tell you some amazing stories that have happened as a result of people treating their diseases with infrared light.
Wow.
And one including a very hard to treat pediatric seizure disorder from a Canadian who was getting seasonal seizures, particularly in the wintertime, without much light. And just 15 minutes of LED light exposure, morning and evening, got rid of the seizures and didn't even need medication for them in regards to, penetrating the bones and having that advantage in regards to those gray matter and the mitochondria in the bones.
Interesting. So I had two follow-up questions there because I'm a big believer both of the morning light that we talked about earlier as well as the red light therapy. First off, you mentioned the medical grade, you only need 400 lux of around 4 to 50 nanometers, whereas if you use the white light, you need about 10,000 lux, which is approximately what you'd get out in the daylight with the sunshine. Would those be something you would want to use, like, again, first thing in the morning? Let's say it's, wintertime, sunrise doesn't come till 8 o'clock, and you want to get your serotonin clock working properly. So, would those two types of lights be useful to have it first thing in the morning to be able to get your serotonin clock on the right path?
Yes, those are best morning light. So morning light is quite superior in setting our clock and getting us to make the serotonin that we need for the day so that we can also make melatonin at night. And so, we definitely prefer the morning light. The infrared light also you can get early in the morning from the sun. If you're out there, you can also get it before sunset in the evening. And it actually seems to be best as far as what we've noticed in regards to the medical use of the LED lights. We're seeing advantage of morning and evening infrared light.
So I actually do that. I don't know if you're familiar with the company Juve that makes these infrared and near-infrared lights, these LEDs. Now, what I've heard is they also help increase mitochondria function in the body. But, when the wintertime, when there's not a lot of sun and you're not able to get a lot of sun, are these things substitutes for not being able to go out in the sun, or is this something that you use in, as a sort of, it doesn't substitute it, but it's still something helpful for your body? Like, how do you relate it to the actual sun itself?
Well, it is a substitute. So if you're not able to either get out in the sun because you've been working indoors or whatever, it is healthy to expose ourselves to that in the evening. Now, it's not a complete substitute. It's still only getting the 850 to 1500 nanometers, and there are other advantages of the sunlight and other spectrums in other ways, but at least it would be able to get that infrared exposure and still have that penetration of those 7 centimeters.
Okay, great. So one person here asked the question, so last night, if you were here, you had mentioned that in many of the mass shooters, or all of them pretty much, cannabis was behind the mass shooting. They just wanted to know what was the source, like how did you find that out?
So this is something you have to compile individually. There's something that happens to just about every mass shooter. I don't know if you've noticed, but they end up dying, usually that day. And then, of course, they start analyzing their blood and start seeing what's in there. And so if you go through those reports, you will find THC in that blood. And so there has been another news organization that also has noted this and posted it. You can see it online. I can't remember which news organization did it. So if they've been able to measure it, if they've been able to find it, so far you have seen that consistently.
Across.
But alcohol, they're also looking at alcohol. Alcohol's not been there in the majority of them, a minority. And other substances, you'll see opioids, you'll see benzos, you'll see meth, you'll see other types of things. But the one substance that's been across the board has been the THC.
Cannabis. So, and just following up on the THC, you hear a lot these days about people using CBD oil, hemp oil, for pain or to help them sleep at night, to relax. But they say the THC has been taken out of that. Do you see any risks for people using CBD or hemp oil?
So hemp, no, we don't see any risks. CBD is a little bit different. CBD does have some beneficial aspects. It can help some seizures. It can help other conditions. The problem with CBD is the source, being marijuana, it's very difficult to get all of the THC out of it. And so we normally see THC contamination with all of these CBD products. and I see that as an issue. And so if we can treat the condition in alternative ways, which we can, many times people are treating anxiety with CBD. By the way, it's not very good treatment for anxiety. It can help to calm you. But there's a substance called Selexon 80, I think we might have mentioned it yesterday, which is the molecule in lavender oil, which is far better for treating the anxiety, but it doesn't cause frontal lobe suppression. Even CBD, you'll get a little bit of suppression of the cognitive function, where with Selexon, you'll see enhancement of the cognitive function. So people with test anxiety, if they take lorazepam, they'll be less anxious during the test, but their scores will be worse than if they didn't take care of the test anxiety. But if you take Lavella or Selexon, the test anxiety is better, but the scores go significantly up. And so I would recommend alternative sources of trying to treat your condition than something that could produce some THC contamination.
Very good. You mentioned, so this is a question about how to prevent hair loss, what is the best natural remedy? I think you mentioned earlier there were some vitamins or supplements that may be able to help with hair situations.
Yes, vitamin K2. Also, there is evidence that infrared itself can also be helpful as far as the hair loss.
Very good. Is bottled water better than tap water?
Well, it depends on the tap and depends on the bottle. As far as bottled water is concerned, there is, and I don't have stock in this company, but the last analysis I saw was the healthiest commercial bottled water is actually Aquafina by quite a bit. And so if you're going to get bottled water, that's the type that I prefer due to the studies. And I actually like the taste of it better as well.
But that's purified water. That's not spring water, right? So would you recommend that actually over spring waters?
No. So if your spring water is actually healthy, you're going to get more of the healthy minerals with it. Magnesium is one of the things you can get in spring water that's particularly healthy, and so you don't necessarily want to take everything out of your water. And of course, tap water, it depends again on the source. But if I know up in Northern California where we live, and we have well water, which is essentially spring water from the Sierras, you can't get a better taste and you can't get better health as far as what's in that in our analysis. I told Erica, if we were just into making money, we would just, get a bottling company right up there and be able to do that. It's so good. But we have better things to do with our time.
Too funny. Just a very funny story. I was in Oslo, Norway last year, and I was at a hotel. And I don't know if you've been to Oslo. Everything is super expensive, but it's also a beautiful country, lots of natural like water and other resources. And I went to the hotel and I said, "Can I get some bottled water?" And the guy looks at me strangely. He's like, "It's the same water you get from the tap." So, go figure. Alkaline water?
So, yeah, alkaline water, it is nice to stay away from the acidic part of it. However, there is not evidence of pushing that alkalinity to 10 that we're actually improving our health. There's this idea that you can totally prevent cancer if you stay alkaline. That's not true. But we do want to stay away from the acidic part of things. Where alkaline water might be able to be helpful is for the typical meat eater, because meat is highly acidic. And they're having issues in part due to that acidic nature. So that's when you'd want to maybe push the alkalinity to try to at least balance out the effect of their acidic diet from their high animal content.
Very good. Here's a question about your resources. This is, are the mental health resources you've talked about available on a website or resource bank?
Yes, so a lot of our mental health resources are available at nedleyhealth.com. In fact, if you look at that, we have a free blog site. We have Let's Talk Mental Health. So a lot of mental health aspects there that are free of charge. And then there are some, like if you're wanting to go through an online depression and anxiety recovery program or Optimize Your Brain program that has some cost associated with it. And so, but we also have in-person ones, community programs. I know there's a gentleman right up here, maybe you can stand up, he was telling me that he thinks he's the only one that's running the community program in the Chicago area here for a community depression and anxiety recovery program. And he's been running a couple of years for many years. And of course we have a new version coming out which will be a government-based version. We've been asked by governments to produce a government-based version, and that's coming out. And so you could get that through a live source, a community source, or of course the residential is also live.
Very good. Well, we've been out of time, but are you okay to go through just a few more questions, or, yeah? Consensus? Yes? All right. Just a few more questions, and then we can break.
It's okay to say no. I'm okay. I'd be okay with it.
I can stay here for a few more hours, just so you know. Yeah. That's a good idea. Okay. So how do you use frankincense for Crohn's disease?
Okay, so we talked about Boswellia serrata, which is Indian frankincense. And how do we utilize it for autoimmune diseases like at Crohn's? We actually measure it out. The amount we used for typical inflammatory conditions like the young woman that we talked about is 400 milligrams twice a day. But for severe Crohn's, something like that, we might push it up to 2,000 milligrams twice a day. The only issue of too much Boswellia, since it is frankincense and a little with frankincense oil, you might get a little bit of reflux. So we'll push it up until they might get the reflux.
I see. Okay. But you can take it in pill format as well?
You can, yeah. It can be in a capsule, a vegetarian-based capsule.
Okay. All right. This one here cracked me up a little bit. It says, if your child will not eat veggies and fruits, is giving them a multivitamin day adequate enough?
All right. So yes, can we counteract all the effects of a bad diet with a one-pill vitamin? Of course, the answer to that is no. But they might need vitamins, if they're not eating any plant foods or any vegetables, we might need to give them something that has folate in it, for instance, or has some of these other vitamins that they're lacking. And so that's one of the questions we get commonly, and of course one of our measurements of people is to see what their vitamin and mineral status is across the board, to see what they might be lacking it as well, or what they could emphasize more food-wise to benefit.
Great. Here's a question about what you think about the low FODMAP diet.
So that can be helpful for certain types of conditions, certain types of food sensitivities. Maybe even rarely irritable bowel syndrome, and so that depends on the individual and disease as to whether we might go that route.
Got it. And because, a lot of people think, a lot of the food, what I realize is a lot of the FODMAP foods are actually vegetables and, things that are natural that you would think would be healthy, right? So how does one person go about realizing whether or not they maybe need to go on a low FODMAP diet?
So you're giving away some of our trade secrets here. But one of the things we do, we don't like these blood tests for food sensitivities, but there is a finger prick type of test where we're looking at particularly IgG and IgG4. It's a much more complex test than what you normally get in the allergy world, but if we do think there's a food sensitivity going on, we will order that test. It takes a full 2 weeks to get it back, and then that can give us even more specificity than just the FODMAP in regards to what could be an issue. And that's the most accurate way we've been able to find to determine that.
Very good. So I'll just do two more quick questions.
And that's by a separate company that does all
that. Here's a question. Are there any natural remedies for tick-borne diseases? And I'm assuming one of those would be Lyme's disease.
Yeah, Lyme is a major problem in our part of the country and a lot of aspects here, even in the Midwest. And it's often underdiagnosed. If we see someone that has all sorts of different physical symptoms and even mental health symptoms, we're going to want to do some very sensitive Lyme testing, because often the physical disease that we'll see behind it is Lyme. And yes, there are a number of natural things that can help. One of those is garlic. Garlic is very anti-Lyme, but you have to take the equivalent of about 18 cloves. And so it can be, so you want to get the odorless garlic, otherwise they will be isolated. I guess if you want to have social isolation, that's another way of doing it. And then there are other natural agents that can go against it. And of course, there's also certain antibiotics. The antibiotics tend not to work so well, though, once it's tertiary Lyme. And so when it has gotten to that level, we're actually reaching more for the natural types of therapies, including infrared and other types of things that, that can help.
Oh, good. So it's good to know that there are natural remedies to manage that. Very good. All right. So one last question, and if you were to, we have this audience here, if they had not been listening to all the wealth of information you've already shared with us, but if you had to just give a person just one message, one statement, what would be your biggest, what would you want them to come away about nutrition? What would it be?
Oh, probably whole plant foods eaten whole. One of the things we want to avoid against is refined foods. These processed foods that refine it, take the fiber out, take the iron out, take all of those things out. This is where the world gets confused, because refined grains, it's actually better not to eat grains than to eat processed refined grains. And so this is where they start throwing out the baby with the bathwater and telling you, no grains, none of this sort of stuff. Well, whole grains eaten whole for most people are very healthy. And so that's probably the take-home message.
So whole foods, literally whole foods and whole non-processed foods. Now, you said something, so I had to take it back. I have a part 2 to the question now. You mentioned last night about eating whole grains, and we just talked about now again about eating whole grains. Now, one thing that's happened over the last 100 years has been, the grains that we have today are not the same grains that our great-grandparents ate and people from before ate. So how can we go about making sure that the grains that we eat are actually the healthy grains?
Well, they're actually more similar than we might think. We need to recognize that the reproductive system that God created this world with in humans is also the case in plants and all of those things. So no matter what plant substance you're eating, whether it's corn, whether it's oats, those aren't identical, completely identical genetically to the original oats, just like we're not identical to Adam and Eve by any means. And so, but it hasn't changed that much. One of the things that a lot of people think of is that because the soil's depleted and all of this sort of thing, that we're not getting the nutrients. If you don't have enough magnesium in the soil, the corn's not going to grow, period. The oats aren't going to grow. So we do need to have those nutrients there in the soil to even be able to get that to begin with. Now, it is true, selenium, if you can get selenium depletion, some of those things that are not in the soil. But overall, if that whole food is eaten, it's going to be similar enough. Now, where I was going to go with this is when you get into genetic modification, when you're putting rat genes GMOs in and those sorts of things. And not all GMOs are bad either. If GMOs are done wisely, they're not they can be actually very healthy. But it's when we're doing GMOs and implanting other types of genes that we're going to see more of those problems. But along those lines too, I could have mentioned also no sugar, no added fat as well. And so it's not just eating whole plant foods eaten whole. There's a lot of junk food vegans out there. You just see what they're eating. It's a lot of processed foods. It's a lot of sugar. It's a lot of other things, but they're proud because they're not eating animal products. And yeah, that might be good for the animal world, but it's not necessarily good for you. So
Thank you. Thank you very much, Dr. Nedley. Let's thank him very much.